بسم الله الرحمن الرحيم وتعز من تشاء وتذل من تشاء بيدك الخير إنك على كل شيء قدير صدق الله العظيم. First of all, I'm very thankful to all of you for even sitting at the after lunch, and I think this was the great talk by Dr. Raza Rahman with the full animation so that it can make you awake. So my presentation is a little bit, but I'll try to reduce my presentation in order to relieve you. So therefore, the topic of
previous slide, sir.
Yeah. So I'll be talking about the ketamine oral nanoparticle formulation, a hope for a rapid, robust, and effective treatment of depression. Although it looks like a hard topic, but I'll try to make it pleasant. So as you all know, the burden of mental health, particularly depression, is rising globally. And this very good slide by the WHO, this depression is a hidden burden. It affects 350 million people around the world. इसमें जो है, it especially affects young generation, and it is double among the female. Why? Because of the biological reason, and also because of their capability to describe their feeling in words, and also because the due respect which is given, should be given by the society, is not given in our countries. And unfortunately, around 1 million people commit suicide, and most of these are because of the depressive disorder. So therefore, it's important to understand this disease. And what is the problem? The problem with depression and other mental disorder, that up to 70% of the treated patients do not experience remission. Remission means when it's completely at the level before illness, and up to 50% they do inadequate responses there. So therefore, we need something which is robust and which really effective. So initially we thought to work on the psilocybin, but later Kadir Khan, who is a atomic bomb scientist, advised me not to indulge in that because the anti-narcotic force will give you trouble. So therefore we selected ketamine. So the other thing is, this is a busy slide, but you can see, iska pointer kahan hai? Yeah. We have to develop a precise medicine which can alleviate the illness as well as reduce side effect. So in JPPS, the Journal of Pakistan Society, we published certain articles in order to address that. And one of them is the environmental factor that was published almost 2-3 years back. Then we published another article by Asim Shah, who is the professor at Baylor College of Houston, Texas, and he gave us a lot of insight what should be done, and especially he talked about the ketamine and also other things. So we thought, why not to have some research on that. So in order to have a precise medicine, the personalized medicine, one of my patients who was very well known, and he asked me that I want to go to America to treat myself further. But I told him, why not to send you your sample for the analysis, the pharmacogenesis. So I sent his sample, you can see, and the result report came with this, that these drugs are good for him, the green are good for him, the red are totally not good for him. So therefore, this is the pharmacogenomic, give us what type of medication is good for that person. So then later on we thought, why not to ketamine? And you all know that ketamine is NMDA receptor agonist. It is administered intravenously, and you know that ketamine has been approved by FDA in 1970, and it's been used as an anti-anesthesia agent. And you know that the half-life is 2.2 up to 3 hours, but norketamine has 12 hours. So therefore, it's a protein binding substance. So what are the therapeutic uses of ketamine? Ketamine can be used in general anesthesia, it can be used in pain, treating depression, treating anxiety, treating status epilepticus. It's a very good useful drug. So then we thought, how to determine the bioavailability? The bioavailability of intravenous 100%, intramuscular 93%, intranasal, it's esketamine. We tried to have some knowledge from regarding esketamine, but they did not allow us to see that. So therefore we went to have our own system. So ketamine formulation, the nasal spray was not allowed us to come, so therefore we tried to, now coming to the nanoparticle. And what is nanoparticle? Nanoparticle is basically, it is a minute, around 100 nanometer. When it's 100 nanometers become, and this can be used in various methods, like for example, like a spherical cluster, and we use this nanoparticle, and this can, even you can have in next future, because nanotechnology in Pakistan is there, and he has developed his own department, and now you will have, we were really worried, because when you wear nano dresses, you will not be located. So we asked Dr. Kadir Khan, if somebody went to Kahuta and he is not visible, what will be done? So therefore this is really a problem, that nanoparticle can create a lot of problem for us. So nanotechnology is used in many things, like for medical image, screening, but drug delivery system is a wonderful idea, so that we picked. So nanotechnology and drug delivery system is basically delivery of active pharmaceutical drug to the target tissues so that it has less side effect, less damage the other part of the body. The oral formulation is very safe, high protein compliance, non-invasiveness, and can easily be encountered if there is some problem. So this is the drug delivery system we made, and we choose, these are the various options, but we choose liposomal method. I don't want to make you confused, but basically it has an advantage. It is drug protection, target delivery system, enhanced solubility, bioavailability, and sustain and control release, and reduce side effect. So what we did, that we made a nano-emulsifying drug delivery, SNED. This is called SNED. This is the new technology, and it will be used in near future in all specialties. So this is the nanoparticle, that how the drug can be reached to up to it's the 100 times. We can overcome the drug prices by going into the nanoparticle, because the raw material can be reduced up to 100 times less costly. So this is the zinc oxide nanoparticle we made, and when it was combined with that, so nano-loaded zinc oxide particle. So this is the rationale of study, where ketamine is, in order to enhance, make it orally, and so that it can be target delivery system. And what was the methodology? Initially we planned to apply on human being, but the IRB, the ethical committee, refused, because it is such a high effective drug. So why then we started it on animals, and we are going to apply now on human being. So the SNED formula was done, and this is the preparation of that. We were really thinking that olive oil will be the best solvent for this, but we found that cinnamon is best. Cinnamon was on the top everywhere. So we made this particle with and atomic force microscopy revealed that it is really a nanoparticle, and it can be used for that purpose. And this is the Skinner box. You may know that generally this is the to develop any drug used for the rat after making it depressed, and this is the animal study of rat, So SNAD was given, and you can see this was the only just water, this was just ketamine, this was SNAD on 2.25, but 0.5 was very having good result rather than 1 milligram. And this was even up to day 12. And this is the forced swim test, which is the gold standard. It's commonly used for study of the depressive like behavior in rodent, and it is used for evaluation of antidepressant effects. So this we use, and here you can again see that the formulation at 0.5 milligram per kg was having very